This is the second Prevent4Work video inspired by the article named "What Does Best Practice Care for Musculoskeletal Pain Look Like?" Musculoskeletal pain can be very intense and disabling, and at the same time, pain is neither a reliable indicator of tissue damage nor pathology. Therefore, guidelines recommend that you screen all patients for relevant conditions to identify those with a higher likelihood of serious pathology. This is commonly known as screening for red flags. Red flag is an umbrella term, but usually it includes fractures, ruptures, infections, compressed nerves, cancers, and rheumatological diseases. Guidelines also recommend that you undertake a physical examination, which could include neurological screening tests, assessment of mobility, and/or muscle strength. In other words, all patients should have a thorough physical examination based on the history, risk factors, and symptoms. To ensure that all patients receive optimal care, you must evaluate progress continuously between sessions. Therefore, most guidelines recommend that patient progress should be evaluated, and that this should include the use of outcome measures. When choosing outcome measures, it is important to consider the age of the patient, as well as the therapeutic aims of the treatment, to ensure that the tools are suited for the patient and specific to the outcome you want to measure. Pain intensity can be a useful measure in some situations, while self-rated recovery, functional capacity, sleep quality, concentration, or quality of life are other examples of clinical outcome measures. For most patients, radiological imaging is unnecessary for diagnosis and treatment. In fact, guidelines tend to discourage radiological imaging unless serious pathology is suspected, there has been an unsatisfactory response to conservative care or unexplained progression of signs and symptoms, or if positive radiological findings are likely to change management.